So Mo Kelso represents the typical type of female patient that benefits from the Morpheus. The Morpheus is now the industry-leading skin tightening, texture improving device. The Morpheus releases radio frequency energy, but in a very, very unique way. It uses long insulated needles that I can set the depth into the SMAS, into the muscle, into the tissues that lift the face, into the facial fat to shrink and contour it, into the subdermal under the skin space. So I can select vertical depth and use multiple vertical depths to selectively target a thermal effect. It leaves the skin undamaged because it's a sharp insulated needle. And then I can also set it very superficial for wrinkle reduction and scar improvement. So with one device, I can lift, I can tighten, I can contour, and I can smoothen. All the things that Mo needed. She had previous acne scars, she has laxity, she has loss of jawline shape and cheek shape. We can also use the Morpheus in combination with typical Botox and neuromodulators like Xeomin and Dysport, and soft tissue fillers like Juvenom and Restylane. And we can put that all into a combination treatment that gives an amazing, youthful result. So the use of the Morpheus and energy-based devices in combination with Botox and fillers. Combination treatment. So combination treatment is typically the best way to achieve a non-surgical lift without excision. So what products and services do I combine for facial rejuvenation? I combine energy-based devices like the Morpheus for lifting and tightening, for smoothening, especially the Morpheus with its insulated 24 needles, allowing me to have different vertical depths for fractional thermal deposition and remodeling, the ability to lift the SMAS, the underlying muscle, to contour facial and neck fat, and to tighten skin and smoothen irregularities, makes the Morpheus the cornerstone of my combination therapy. On top of that Morpheus, I can layer selective soft tissue fillers for contour, for shape, for lip and other anatomic restoration. I can take Botox and uncouple the depressors to get an elevation of the brow and the cheek to support and synergize what I'm doing with the Morpheus. And then finally, I can use thread suture suspension techniques, barbed bidirectional PDOs and suture suspension to lift and suspend the tissue that I've just heated for a long-term benefit. So combination therapy, the use of energy-based devices, injectable Botox, injectable soft tissue fillers, and maybe even suture suspension thread lifting to give a non-surgical facelift, a real wow effect without the scalpel. You know, you see these celebrity shots, red carpet, junkets on film, on TV, and they look great, but they're all working at it, and you can do it too.
I'm Mo Kelso. I'm definitely a career woman. I used to be told to smile all the time, and what are you so angry about?
I break the face down into the 3 Ds of growing old: deflation, descent, and deterioration. And I usually start with descent, and we start with Botox. So we're in the treatment room, and we're going to get Mo to smile, big smile. Now her elevators are lifting, relax, do a mouth pout. You see that very strong muscle? We want to hit that depressor first, so a little bit of Botox right in that specific depressor. Her down-going mouth muscle, that resting something face that people don't like. And so what will I have accomplished over 3 to 6 days? This will come up by putting the depressor to sleep, allowing the elevator to elevate by using this little chemical Botox. So our second D, deflation, probably the most important, is the addition of volume. In general, you want to see the upper third, middle third, and lower third look balanced. So the volume replaces the fat that she's lost and creates a natural version of her versus someone different. This is a sugar gel, a clear, soft, viscous gel that acts as a fat replacement wherever we've lost fat. So let's bring back the fullness of youth. So I take a little port creator, we create a little hole under the skin, and we're going to go to a blunt micro cannula. And so we go through that little hole, and so we're going to do under the eye, add a little bit of volume. So I inject on the way back, advance, inject on the way back. And we're going to build up the smile line in the corner of the mouth. And so a little bit of volume to soften that smile line. And we go down to the bottom of the jawline segment, and perfect. So we've been able to create a nice rejuvenation of that jawline. We've been able to recreate that fullness of youth. We used about 10 syringes of sugar gel, but we did it in so many areas with such a little amount of product that even at her maximal injected point, she looks pretty good. Our final D is deterioration, and now we bring energy-based devices. And we color correct the redness, the sun damage, we even out acne scars and tighten the skin. So we're going to take a photofacial device that uses flashing light for color correction. So this is going to decrease the redness, decrease the brown, and the bright light fades the color over about a week. Our last energy-based device is radio frequency energy for tightening and texture. And we penetrate the skin with these little needles that go in about 2,000 microns, and they release a warmth and a heat that causes internal tightening and contraction. And so great for acne scars. And we can tighten along the jawline. Okay, and again, we get a beautiful improvement in your skin almost immediately with this kind of radio frequency device. Hello, Mo. Good to see you again.
Hello.
You're looking great. Look
Thank
at you.
you.
So here we are, 6 weeks from our big adventure.
Yes.
Our intervention, we'll call it. And so, first of all, on the day, it's uncomfortable, but did you find it tolerable?
Oh, absolutely. It was worth the whole time.
But you know, you are going to look significantly younger, more refreshed, more youthful. It's important that, you know, that the people watching this show understand there is going to be a little discomfort. And we can use topical cream like we did with you. We could add local anesthetic if we wanted to. We could add laughing gas and nitrous oxide. But the point is we make it tolerable. Okay, so it's tolerable. And then tell us about your recovery. What was your recovery like?
The recovery was really easy. It was painless. It was quick. I returned to work the very next day.
So you were able to get makeup on the next day?
Oh yeah, and I hardly used any makeup actually. Yeah.
So you did some fillers, just to remind everyone, you did fillers to shape and volumize your face,
Yes.
but not over-inject it. We used some Botox to uncouple the muscles that pull your face down, and then we used this new Morpheus, this radio frequency tightening and lifting device. And so which of those treatments gave you the most recovery?
The Morpheus really has been incredible because the results just seem to be getting better and better. The skin tightening, and because of my age, I am noticing, and people I know are noticing.
So
they're
actually,
telling me that they're
interesting.
that people are saying to me, Mo, like you look like you're 10 years younger.
Wow.
And when I meet people for the first time, which is often in my business, I'm in radio sales, I deal with people every day who are trusting me to know everything there is to know about modern day media and what's going to be best for them. So they think that I'm 20 years younger than I actually am, and of course I don't correct them.
Of course not, yes. So you want to be mature enough to that you're experienced to be able to sell the product, but not look like an old person. No one wants to buy from an old person.
Indeed.
Okay, well great. You know, when I look at you, I'm just going to grab a little Q-tip here, and we'll give you the mirror. I think you look great. And so, you know, people can look at the before and hang on here. When you see the before and afters, have you had a chance to see them?
Oh yes.
Yeah, so the before and after show clear improvement on the volumization of your cheek. Not too much, but enough to give you a nice oval effect. It's tightened up your jawline. The Morpheus is giving you tightening, and interestingly, you notice it's getting tighter week after week after week. And so you're going to tighten from the Morpheus for a good 4 to 6 months. The Botox helps uncouple those muscles that pull your face down, and so the integration of those three things, energy-based devices for color and texture, Botox for uncoupling and elevation, and fillers to give you appropriate shape but not too much. I think it's worked very well for you because you look really good. You look glowy but not done.
That's exactly how I feel, and I was concerned about still looking myself, but just an enhanced version. My confidence has shot through the roof.
Perfect.
My sales have improved.
Well, there we go. Excellent. Well, I'm going to have to listen to your radio now. I think when it's all settled, this cheek sweep now matches your jawline, which looks awesome. You had a little bit of pre-jowling, remember, around
Yes.
and the tightening from the Morpheus has been great.
Incredible.
Really looks quite good.
Yeah.
You don't look tired under the eyes to the same extent.
that has been
You have
wonderful.
a little elevation of your brow, so you have that nice sort of elevation of your tail of your brow, that little nice tail of brow sweep here.
Yeah.
And so you have 3 sweeps, the brow, the cheek, and the jawline, and they all kind of match. And there's been a very anti-Newtonian effect, so you're not being pulled down by gravity.
Yes.
And your skin looks smoother. You did have, you know, the trouble with acne scars when you were younger, and to me, they look about as smooth as I remember seeing them in a long time.
They've really improved.
And so So that's great. So I think we achieved what we wanted to achieve. The question is now how to protect your investment. What kind of simple program could you anticipate? I think you would continue doing your Botox twice a year, a little filler and top up and optimization once a year. And then the Morpheus will give it a good 6 months to do its thing. And you might just do one assertive treatment like we did once a year when you do your filler, or drop back in energy a bit and do a milder treatment twice a year when you do your Botox.
Okay.
So I think that's a very simple maintenance program, twice a year. Once it's for filler, Botox and Morpheus, and once it's just Botox and Morpheus, and you should look 15 years younger forever.
I love it. Thank you.
Perfect. Well, I'm glad it worked. I look forward to seeing you in your maintenance treatments.
Thank you.
So we've got to see firsthand with our patient Mo Kelso the value of the Morpheus. Insulated needles with vertical and horizontal fractionation. As the physician, I can set the vertical height. I can have multiple vertical heights. I can deposit selective therapeutic contraction using thermal energy wherever I want. For Mo Kelso, it was along the SMAS and the deep muscle for the lift, along the skin to tighten. It was within the acne scars to smoothen, the wrinkles to smoothen, and the fat to reduce and shrink. So selective, thermal, vertical, and horizontal Morpheus rejuvenation. And we saw the tremendous amount of improvement in her skin. And in fact, she's had multiple energy-based devices over the years, and she found the Morpheus by far the most effective single treatment device she'd ever had to improve all qualities of her aging face. We combined various aesthetic treatments that were not excisional. Fillers, Botox, and the Morpheus. The only product and service we didn't include was suture suspension thread lifting. And even combining volume, toxin, and Morpheus, she's had a tremendous improvement in all qualities of her skin. Her face looked more oval, her jawline was tighter, her acne scars and wrinkles were less, her shape and contour was very, very youthful. She clearly looked 15 years to 20 years younger than her advanced chronological age. Although she's in her 50s, she looked like she was in her 30s. So non-surgical techniques used in combination, the right combination, can lead to astounding facial rejuvenation when done artistically and scientifically. Select the layers of tissue you want to treat. Take your energy-based devices, combine it with your Botox, your fillers, and even your suture suspension thread lift, and you can achieve tremendous rejuvenative effects without a scalpel.